I don't think you're going to find an ER person that hasn't been kicked, hit, bitten, spit on very shortly into their career. It's something that happens on a regular basis.
These are unsettling times in the healthcare industry after multiple cases of violence have been reported against nurses and other hospital staff.
Valley News Team's crime and safety reporter Bailey Hurley talked with local nurses and physicians who say some sort of violence happens to healthcare workers almost every single day.
Again, I've said that it's probably underreported, so it would be a pretty good guess to say, yeah, it's probably happening at least once a day.
With opioid addiction still an epidemic and the number of mental health problems skyrocketing, emergency room staffers are no stranger to violence.
I don't think you're going to find an ER person that hasn't been kicked, hit, bitten, spit on very shortly into their career. It's something that happens on a regular basis.
An issue that Essentia Health says they're actively trying to tackle.
I push nurses to report it. They didn't spend all that time becoming educated to help people to come in here and get beat up.
We can't follow up and make any improvements unless the incident is reported.
But Scribner says all staff are trained to try to prevent situations from ever getting to the point of violence with de-escalation tactics. But when that doesn't work, he says there's always security officers throughout the buildings, as well as Fargo police just a call away when extra backup is needed.
No, it shouldn't be like that for any workplace, much less, healthcare. It should not be accepted.
But it's not only emergency room staff who experience workplace violence.
He pinned me down on the bed and I was screaming for help, and he was a lot bigger, so I couldn't even reach for anything. I wasn't given a panic button at the time either. All I had was a call light that I elbowed, and no one came to the room for around 10 minutes.
Kramer says that was when she was on a psychiatric floor, but adds her new role at the walk-in has its problems too.
It's almost like you become numb to being verbally abused. You become used to it, and it shouldn't be that way.
With Scribner adding that verbal abuse is what he sees reported the most.
They'll try to intimidate staff and say they're going to come back, or they'll say they'll make you hurt like they're hurting.
The patients take out their aggression on the nurses when I don't give them what they want.
Many times putting healthcare workers in a compromising position.
That's the frustrating part about it, about the whole thing, is if they do act out and they do assault, they're still our patients. We still have to provide care.
At that point, do we take their rights away from them? Do we have to sedate them against their will, put them in restraints, or do we say the street's right there, it's time for you to leave?
I know people are sick, they're sad, they're in pain, they're sensitive, but we're trying. We want to help you.
In Fargo, Bailey Hurley, Valley News Live.
Essentia says most physicians and nurses have panic buttons on their badges in case of emergencies, as well as several discreet buttons placed around all of their facilities.
Still